So coming to the treatment aspect of heart attack. Now that we have diagnosed a particular person is having heart attack, how do we treat him? How do we treat a person having heart attack? There are two established modalities of treatment of heart attack. First is called as a thrombolysis, and second one is a primary angioplasty. So I'll try and explain to you what exactly each terminology means and which modality of treatment is better compared to the other modality. So coming to the first modality of treatment, that is thrombolysis. Thrombolysis is a self-explanatory term. As we've already seen what exactly heart attack is. Heart attack, as we've seen, that it is nothing but blockage of blood vessels supplying blood to the heart. This blockage of blood vessels happens due to a cholesterol block which gets ruptured and forms a blood clot. So cholesterol block ruptures and forms a blood clot which ultimately completely blocks the blood supply to the heart. So thrombolysis is nothing but giving an injection to dissolve this blood clot. So injection that is given into one of the peripheral veins which goes up to the block and tries to dissolve it. But there are flip sides of this particular modality. This is the oldest known modality of treatment of heart attack. The flip side is the success rate is not very great, maybe around 40 to 50%, that's all. And also there is risk of bleeding. So since this is a lysis, that is a medicine that causes blood, that prevents blood clots or dissolves the blood clots, it can lead to bleeding anywhere in the body. And in certain situations, if there is a massive bleed within the brain, then there can be it can lead to a paralytic attack, or if there is bleeding in the stomach, then it can lead to blood vomitings and etc. So thrombolysis is nothing but giving an injection to dissolve the blood clot. The success rate is anywhere between 40 and 50%, and the major problem with this thrombolysis is the risk of bleeding, sometimes which can be fatal. Coming to the next modality, or the gold standard modality of treatment, is primary angioplasty. That is nothing but a stent, placement of a stent in the blocked blood vessels. This is considered to be the gold standard treatment when it comes to a heart attack. So what exactly is done in primary angioplasty? Similar to an angiogram, we do first an angiogram is done to locate where exactly the block and the blood clot is. Through this catheter, another stent is nothing but a spring like structure. I'm sure all of us have seen the refill spring. It is something similar to that, but it is much smaller in size, much finer in caliber. So this particular stent is introduced through the catheter to the place of the blockage in the blood vessel, and then this stent is expanded so that the blood clot gets attached to the wall of the vessel and the pathway is cleared, so that the blood flow gets re-established to the heart muscle. So this is the gold standard treatment for heart attack, primary angioplasty. All this said and done, the most important aspect of treatment of heart attack is time. I'm sure all of us are aware of the age-old saying. I'm sure we must have heard our parents and grandparents telling us that time is money, that we should not waste time. Time is very precious. Exactly, it is very much similar in cases of heart attack also. If time is money, in another sense, when it comes to heart attack, we call it as time is muscle. That is, more the time that has elapsed, the greater is the damage to the muscle. So treatment, if initiated early in cases of heart attack, the chance or the success rate is very, very high. In this scenario, there is a concept called the golden hour. That means the first 1 hour within the onset of the heart attack is considered to be the golden hour, because if treatment is initiated or if treatment is started in this first hour, the success rate of treatment is very, very high, and the chances of mortality, that is the chances of death, are very, very low. So important thing to be considered here is the time. Do not waste time. As soon as a person develops chest pain, it is very important for him or her to approach a doctor and then proceed. So this is again, in this scenario, I would like to again emphasize about the differentiation of gas and heart attack. So as we've already seen, do not misinterpret any chest pain or chest discomfort chest discomfort as gas because it can be heart attack, and if treatment is delayed it can lead to very high chances of death. So do not misinterpret or do not confuse a chest pain to be that of a due to that of the gas.